Hi friends, in this series of fluid therapy, today I will talk about albumin. First is the disclaimer. Caring Docs YouTube channel does not provide medical advice. Information available on this channel does not offer the diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only and it should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of a medical expert for diagnosis, prevention, and treatment of the medical illnesses. There is no endorsement for any brand or a company or product. Friends, albumin is a physiological plasma protein. Chief function of albumin is to maintain plasma oncotic pressure and it is responsible for 75% of the oncotic pressure of the plasma. Albumin helps to maintain the blood pressure. It helps in transporting small molecules like bilirubin, hormones, and certain drugs. It is available in the market as 5% solution, that is 50 gram per liter, or 25% solution, that is 250 gram per liter. This 25% solution is also called salt poor albumin because it has a small amount of sodium. Coming to the pharmacological basis of albumin solutions, the 5% albumin, that is when it is dissolved in 50 gram per liter or 5 gram per deciliter, it has a colloid osmotic pressure of 20 mm of mercury, which is similar to that of plasma. Approximately half of the infused volume of 5% albumin stays in the vascular space. It expands the blood volume by the same amount as the infused volume. Half of the infused volume stays in the bloodstream, and this oncotic effect of 5% albumin remains for 12 to 18 hours. 25% albumin, it has a colloid osmotic pressure of 70 millimeter of mercury. Thus, infusion of 100 ml of 25% albumin can increase the plasma volume by 400 to 500 ml. It expands the blood volume by 4 to 5 times the infused volume. This plasma volume expansion occurs at the expense of the interstitial fluid volume, that is, the fluid shifts from extravascular space to intravascular compartment. So 25% of the albumin should not be used for the volume resuscitation in patients with fluid deficit, that is hypovolemia. And hence, in patients with hypovolemic shock or patients with hypovolemia, those who are receiving the hyperoncotic concentrated 20 or 25% albumin should be adequately hydrated with IV fluids such as isotonic saline or 5% dextrose. Albumin is a preferred solution in patients with hypoproteinemia along with anasarca or oliguria, where the intention of the albumin infusion is shifting fluid from the interstitial space to the vascular space. Indications for the use of albumins are: it is required in the condition where there is rapid volume expansion is required. So it is an ideal solution for rapid volume expansion as it quickly replaces the fluid in emergency situation like acute hypovolemic shock, burns, or severe albumin loss. It is also used in the correction of hypoproteinemia in patients with liver disease, patients who are diuretic resistant nephrotic syndrome, or malnutrition. The infusion of 25% albumin is very effective for short term management. It is used as an exchange fluid in therapeutic plasmapheresis as exchange fluid to replace the removed plasma or the fluid. The adverse effects of the albumin usage are rare but may include nausea, vomiting, febrile reaction, or allergic reaction, including the anaphylactic shock. We can summarize the medical uses of albumin as: it is used in hypovolemia to expand the blood volume in emergency situation. It is also used in prevention of central volume depletion after the paracentesis, Paracentesis procedure, as I already discussed, patients with ascites where the large volume of the fluid is aspirated out, then there we have to give albumin. It is used in patients with hypoalbuminemia, but we have to be very cautious. It is given only when it is very necessary. It is used in ovarian hyperstimulation syndrome to expand the blood volume. It is also used in some patients of acute respiratory distress syndrome when it is used with loop diuretics to treat the ARDS. Patients with acute nephrosis or nephrotic syndrome, albumin is used to treat edema in patients with nephrotic syndrome. It is also used in patients with hemolytic disease of newborn. In pediatric patients, it is used in patients with burn hypovolemia because burn causes excessive fluid loss with the proteins. Extensive hemodialysis patients may require the use of albumin to treat the hypotension which is caused during the hemodialysis. It is also used in cardiopulmonary bypass surgeries. It is used as a colloid for priming the extracorporeal circuits. The various precautions are the contraindication for the use of albumin are it should be given as a slow infusion because rapid infusion can cause increased circulatory volume with the resultant vascular overload and pulmonary edema. The various contraindications for the use of albumin are it should not be used or it should be avoided in patients with severe anemia, cardiac failure or dehydration. It should not be used or should be used with cautious in patients with cardiac insufficiency, especially the patients who have low cardiac reserve. It is also used as a addition. It should be sorry. Additional fluid should be used in dehydrated patients because albumin infusion will not correct the dehydration. There we may need extra fluid also. It should not be used as a nutritional supplement as a parenteral nutrition. The dose calculation of albumin is the amount of albumin solution administered will depend upon the clinical condition of the patient and his response to the treatment. For adult patient, the initial infusion of 25 grams of albumin is suggested, that is 500 ml of 5% solution or 100 ml of 25% solution. Initial infusion is 25 grams of the albumin for adults. For 5% solution, 500 ml is given at a rate of 1 to 2 ml per minute. For 25% solution, the 100 ml 1 ml per minute infusion is started. We have to adjust the dose based on the patient's condition and response. Higher rates may be needed in patients with shock. Val Sainsbury had said, nurses dispenses comfort, compassion and caring without even a prescription. With this, I conclude my topic on albumin. Thank you. Keep learning.